Hello everyone, my name is Dr.
This crazy living's got you out of control. It's so beside you when you're losing your soul. She looks you over with your luck and get out. No passing on you when you're all by yourself. Time won't break, won't shake, won't slow, won't fall.
Hey everyone, Dr. Owens here. I'm going to just give you a few quick exercises to help you with shoulder pain today. What happens during life is that as we work on computers, the shoulders become rolled forward. As it does that, it puts stress on the back, so we tend to feel pain in between the shoulder blades. There's some exercises we can do to help this. The first one I like to use is, most of you might have a little stretchy band sitting around at home. This exercise is called the band dislocates. You put it a comfortable width apart with your elbows locked, and you just work it back over. I like to call it like the hump. You'll hit it, there's a tight spot, little shoulder restrictions in the posterior capsule and shoulder ligaments. And doing this exercise really works that out. When you first start, it'll be really tight. I like using the band because it's a little bit forgiving. Some people have seen this done with maybe broomsticks, where you hold the broomstick at a certain width and then go over the back. That doesn't give you too much give. When you're first starting out, it's nice to be able to do it, have a little give in the stretchy band. Use a fairly light stretchy band and do it about all right. The second thing I like to do for shoulders is strengthen the rotator cuff. And several ways to do this. But if you have a band, I have a band set up here at the office and at home, and it makes things really easy. The first one is where you'll take the band. You'll want to use a light band. This one's actually a little bit too heavy for me on the rotator cuff. Use probably one of the red ones, or maybe even lighter. No need to get heavy on this, because you're going to be doing about probably 2 sets of 12 reps. So, to start the motion, we want to pull the scapula in, the scapular retraction as it's called. Pull it straight out. I'm going to step in to give myself a little bit more slack, and then roll it up. Back again. So again, the exercise is pull in, straight out to the side, and up. I'm straining with this weight a little bit because it's just a little too much for me. So pull it in, boom, up. We're going to do it about 12 times. I think it's called the rotator cuff L, but I'm not sure the exact name of the exercise. The bottom line is we're externally rotating the shoulder. Dr. Owens here. I want to show you a quick strengthening exercise for the subscapularis, for the front of the shoulder blade. It also helps keep the shoulders nice and tight. Every shoulder problem should be doing these. And it's referred to in most circles I've heard, it's called the push-up plus. And in a push-up, of course, we're doing this. And that's a basic push-up. It's foundation for a lot of workouts. What's often neglected is the little ranges of the shoulder that have to be there for the little muscles of the shoulder that have to be there for shoulder stability. With the push-up plus, we're working those little muscles, and we rock. To do it, we rock down, and you feel the tension towards the back, and then almost like lengthen the arms and arch and roll the shoulders forward. And as you go through this motion, you'll feel it really tightening and strengthening down here. You may even feel some lactic acid burn. Start on all fours with a light. That way you have a nice light weight. You may feel the lats in this exercise a little bit. I do a bit. As it gets stronger, you can go out to more of the girly push-up position as the push-up plus gets stronger. But there's no need to go with any great weight on this. I mean, if you weren't feeling anything, you could go to the full-on push-up position and work it through. I really get a burn on that. So I typically do it in the girl push-up position or even on all fours because I'm doing it in preparation for your chest workout, your shoulder workout, where you want to get the shoulders really warmed up. But it'll help with the strength of the shoulders. It'll help with shoulder pain type problems as well. So that's Dr. Owens with a quick rotator cuff exercise.
Hello everyone, my name is Dr. Owens.
Hello everyone, Dr. Owens here. I want to show you a quick strengthening exercise for the subscapularis, for the front of the shoulder blade. It also helps keep the shoulders nice and tight. Every shoulder problem should be doing these. And it's referred to in most circles I've heard, it's called the push-up plus. And in a push-up, of course, we're doing this. And that's a basic push-up. It's foundation for a lot of workouts. What's often neglected is the little ranges of the shoulder that have to be there for, the little muscles of the shoulder that have to be there for shoulder stability. With the push-up plus, we're working those little muscles. And we rock. To do it, we rock down. You feel the tension towards the back. And then almost like lengthen the arms and arch and roll the shoulders forward. And as you go through this motion, you'll feel it really tightening and strengthening down here. You may even feel some lactic acid burn. Start on all fours with a light. That way you have a nice light weight. You may feel the lats in this exercise a little bit. I do a bit. As it gets stronger, you can go out to more of the girly push-up position as the push-up plus gets stronger. But there's no need to go with any great weight on this. I mean, if you weren't feeling anything, you could go to the full-on push-up position and work it through. I really get a burn on that. So I typically do it in the girl push-up position or even on all fours because I'm doing it in preparation for your chest workout, your shoulder workout, where you want to get the shoulders really warmed up. But it'll help with the strength of the shoulders. It'll help with shoulder pain type problems as well. So that's Dr. Owens with a quick rotator cuff exercise for your shoulder health. Hey guys, Dr. Owens here. I'm here with a patient, Chloe, and I just wanted to show you one of the things that we can do with your shoulders, especially for someone who has chronic shoulder problems, issues where uncomfortable cracking and popping occurs. One of the procedures we do in this clinic is a procedure called kinesiotaping. Skin up allows fluid to flow through the subcutaneous space, allowing the joints to heal. It also brings up nervous system awareness of these joints, so the joints move freer and smoother. Every time the patient moves the joint, it's actually causing a healing action. We taped her scapular muscles here, where a lot of people have pain in between the shoulder blades. This can help support that. We did the trap muscle. Those upper traps can get really tight and are involved in the whole shoulder girdle scapular complex. And then we did a basic deltoid taping, where we tape the outer edges of the deltoid here and the support strip up the middle. Pretty thorough shoulder taping job. I just wanted to show you it is within the scope of some of the things that we do. So, whether it's a simple problem or whether it's a really complex problem, we can help you out. All right, have a great day, and Dr. Owens will love it. The next exercise we're going to do is for the upper back. Again, we're using our stretchy band. If you're doing this at home, you'll put this in the door, and you'll put it securely into the door where the hinges go. Close it tightly, and make sure it's real steady before you do this. But do in a row. This helps the upper back, the shoulders. For this, we can give our nice little scapular contraction there and row back. Pull it. If it's uncomfortable here, pull it a little lower, or you can pull it a little higher if you want to concentrate on the upper back. Honestly, it doesn't matter, just as long as you're getting some of the basic form in there. Again, 2 sets. Starting out, 2 sets of 10 to 12 reps. Hands up, hands down, does not matter. I like to vary it a little bit personally when I do this one at home. So that's our rowing exercise. All right, the second thing I like to do for shoulders is strengthen the rotator cuff. And several ways to do this. But if you have a band, I have a band set up here at the office and at home, and it makes things really easy. The first one is where you'll take the band you'll want to use a light band. This one's actually a little bit too heavy for me on the rotator cuff. Use probably one of the red ones or maybe even lighter. No need to get heavy on this because you're going to be doing about probably 2 sets of 12 reps. So to start the motion, we want to pull the scapula in, the scapular retraction as it's called. Pull it straight out. I'm going to step in to give myself a little bit more slack and then roll it up. Back again. So again, the exercise is pull in, straight out to the side, and up. I'm straining with this weight a little bit because it's just a little too much for me. So pull it in, boom, up. We're going to do it about 12 times. I think it's called the rotator cuff L, but I'm not sure the exact name of the exercise. The bottom line is we're externally rotating the shoulder. Good morning, everyone. Dr. Owens, chiropractic of Bellevue. And today I want to show you a great little technique I learned and that I use myself to keep the shoulders pain-free, keep them mobile, and help you before your workouts, after the workouts. And all you need is a little stretchy band. And you can use any kind of stretchy band that you like. The exercise is called stretchy band dislocates. And what we're doing is we are going to work the shoulder through a range of motion where it's tight. Because we seldom move the shoulder back. We're always forward, doing computer work or working on stuff. To keep the shoulders healthy, we have to stretch them backwards, which stretches the pecs, but also work the joint capsule in the posterior or back aspect of the shoulder capsule. So that's what we're doing here. We're just mobilizing it. I suggest 10 to 15 times, and as you work that, you can feel it, and you'll start to get a little lactic acid burn. That's good. It's doing what it should do. Don't get too crazy with it. When you start out, what's nice about the stretchy band is that it'll accommodate with you a little bit. So you can start out, if you can only go to here, keep your arms locked. If you can only go to here, great. Work that motion. As you become more flexible, you can choke in on the band a little bit more, get a little better stretch as it goes over that. I'm Dr. Owens. Use this to help your life. Have a great day. Thank you for watching my video. Dr. Owens, chiropractic of Bellevue. Welcome to our new office. Today I wanted to go over with you a typical office visit, which is a treatment that we do every day, the checks that we go through, what we look for and what we correct on the spines to help the people's health every single day. So today we're going to use Kate as our model, and she's going to help us demonstrate this whole thing. So Kate, let's have you start out face up on your back. Now typically we'll start out face up on the back because I need to address the cervical region or the neck. So as we check through the neck, the main thing I'm looking for, as we've talked about in my other visits, is both misalignment but also the ability of the spine to move freely. The free motion of the spine, every bone of the spine, that's essential for health and nerves and nerve health in the area. So as we check, we see that there's some slight fixations and bones out of place in her lower neck, so we're going to go ahead and correct those. We wouldn't necessarily use this manipulation on kids or elderly people, but for someone like Kate, it's perfect because we're able to restore that little bit of motion in there. And we'll do the same thing, that lower neck here. Good. Excellent. And we'll come back to that in a little while with the instrument to just fully restore it. But I found that using the manual adjustment first really gets the big problems out of the way, and then we're able to fine-tune it with the instrument later. So we found a misalignment in her middle back here. And we're just going to free up the motion in that area. Now we're going to check her lower back. Turn towards me on your side, Kate. So as we go through systematically the spine, there may be other problems that take precedent, but on average, I'm going to check things in this order. You can see with my hands I'm motioning the spine. I'm using her hips to motion the spine to feel what's moving and what's not moving and what's jammed. Kate has bone that's jammed in the upper lumbar area. So I'm going to contact this, do just a little correction there. Okay, let's go on your stomach, face down. Now typically after we check the main areas, there's some fine-tuning that needs to happen. And for that I use the arthrostim. You may have seen the arthrostim on my other videos. It's just a tapping instrument that introduces motion into the spine. So we're going to just work the spine. Kate has an older injury down here in the lumbosacral region, so we're going to just free this up. And I free it up until I start to feel that nice springy function. That tells me that we've introduced all the new motion that we can, and the body has to go, the body has to do the healing process after that. Ultimately what we're doing is we're freeing up what motion we can for the day, and then the body, the patient has to go home, and the body will start to reconstruct the area and do the healing. The healing takes place at home in between visits. Almost like when you're working out at the gym. You don't get bigger and stronger while you're working out. You get bigger and stronger after your body heals from the workout. Okay. There's an area in Kate's mid-back that we're going to touch up. Right here. This is an adjustment that actually does help restore the cervical curve. Many of you that have seen chiropractors before maybe have x-rays where the normal healthy curve of the neck has been lost. This helps restore that, or at least the function of that area, so that you then don't go on to develop the arthritis that comes from having bones that are being stuck in the same place and not moving. So, again, our whole goal is restore the function and motion of the spine. A healthy, movable spine does not develop arthritis. A healthy, movable body does not get sick. So, this is a very gentle rib adjustment that I've been working with and developed to kind of allow the rib cage to move so that full breathing can occur. Energy levels improve when the breathing occurs normally. A lot happening during a real typical office visit, and a lot that we decided to include in our just routine protocol, mainly because these are the things that, due to the stresses that we're experiencing in life, the body needs. So we'll just continue to work that out until we feel that nice springy motion where it was really tight before. Just a touch up there. Now, at that point, Kate normally does this. We've restored all the motion and function into the spine that we can for that day. Now, I like to just use a device called the Genie Rub or the Master Massager. And what we're doing at this point is putting vibration into the spine. It's taking the areas of correction that we've done and we're like enforcing it. We're putting the shellac on it, so to speak. So we're wakening up the whole body, enhancing all those nerve impulses so that healing occurs that much faster. It also can remove any residual soreness that may exist. So this is normally the part that my assistant Kate, who I'm working on, she'll normally be doing this part of the treatment with you, and quite frankly, it tends to be the part of the treatment that people like the most. So don't worry, we won't skip you on this process. If you're in here for the treatment, this is included every single time. So. Make sure we get all those muscles down the side, the rib cage there. Good, good, good. All right, Miss Kate, you're all done. And that's our typical office visit here at Chiropractic of Bellevue. I'm glad you could stop by with us, at least virtually today, and we'd love to see you here in the office in the future. Again, our number is 425-802-5444.
5432. Give us a
Thank you
call.
for watching my video. Have a great day.